Hi. Okay, I'm gonna move this phone out of here. Let's see. I'll just put it over there. Don't mind the ringing phone.
Just ignore the ringing. It's not there.
Hi everybody. Happy Monday. And I think we're just waiting to go live on.
We are live.
We're live. Hi everybody.
You're like so live.
Okay, so we're so live. Right on. So today is Monday. We had a busy weekend here at the birth center. We caught a bunch of babies, which was exciting. Everybody had a lovely birth. We had a little bit of a baby storm, so so my brain is still sort of like recovering.
It's like mom brain, but like midwife brain.
It's like, oh my gosh, it was really intense, and you don't sleep for a couple nights, and then, because we work during the day, and then we'll birth through the night and to the day, and then have to do whatever was scheduled for that day. So I had to continue the rest of my day. And so then I didn't sleep until that night. And then the next day we have to do all the home visits on all those babies that were born. So I finally got home last night and chilled out at about like 5, 6 o'clock last night I've been going since forever, a couple of days. Anyway, so here I am. And we are going to talk about childbirth education classes today. So if no technical difficulties, we're all good to go.
We're good to go. Okay. It's just I had to get everything without the tripod today.
Okay. So childbirth education. So this comes up quite a bit, and whether or not to do a class, what kind of class, what information are you trying to gather? And there's lots of different options when it comes to childbirth education. And we do recommend childbirth education, certainly for first-time parents. It's a really great opportunity to be in community with people and really understand the stages of labor and how to cope in early labor specifically is really important. And you get that information from a childbirth education class. Subsequent parents, it's important, depends on how long ago your last baby was. Is this the same partner, a different partner? Do you want to try something different this time? So we really focus on childbirth education for our first-time parents. And then we talk about the different types. So a lot of people say, no, I'm not going to do a class. I'm just going to, I'm listening to birth stories. I'm watching births on YouTube or some streaming platform. And that's good. That's great to hear some of that stuff. But what's really useful in a childbirth education class is some practical information about understanding the stages of labor. And because the number one reason that we transport at our birth center is for first-time folks that are having a long, early labor, and they don't identify, or they really can't grasp the concept that it's still early, and so they're paying attention to contractions sooner than that is optimal, right? Because they're not really understanding the stages. And then people around them are starting to get nervous, and so lots of attention is paid in the early stage of labor, which is 0 to 6 centimeters. That is early labor. And so when you take an in-person childbirth class, or an online childbirth class as well, but in-person childbirth classes are so effective because you have that fellowship, you have the dynamic of other people in the room with you, whether or not you're introverted or extroverted. It's useful to be in community with people so that you can hear other people's questions, things that you maybe didn't think of on your own, or that your partner didn't think of. So we think that in-person is really helpful. And there are different styles of childbirth education, but one that is going to go through what these stages of labor are and give you some practical, hands-on, tactile experience with how to time, what positions to get into so then you can feel those positions in your body, what positions for someone to help you in terms of comfort measures like double hip squeeze and rubbing your back a certain way and certain type of touch and essential oils, or a variety of comfort modalities is really useful when you're in community with people to actually have a tactile hands-on experience. Versus watching birth videos, we don't know how much of those have been edited. We don't know really what you don't really get the whole picture when you're just watching birth videos. And hearing birth stories is excellent. And there are some wonderful books out there that have birth stories written down that can give you encouragement. But when you do the childbirth education class, you actually learn hands-on practical early labor, how to time the contraction, what do these contractions mean, what is actually going on in the body, and how people around you can support you. So there are different types. So there's Bradley. A lot of people have heard about Bradley childbirth education, and that's generally I think they're usually about 12 weeks long. That's a very long childbirth education series. There's tremendous amount of wonderful information that you can get from a Bradley class. We think that a Bradley class is really super duper great if you are certainly having a hospital birth. It's great for certain out of hospital births, depending on the type of midwife that you have, whether you're doing community childbirth, community prenatal care, or you're doing individual care with a midwife that gives a lot of information about nutrition, because Bradley really goes through a lot of nutrition, lots of support by a partner, and really super comprehensive. In our practice, we go through a lot of that information in our prenatal visits. So as much as we love Bradley, some people don't have the 12 weeks to commit to that kind of education. So we rest assured, we're going to cover a lot of that information in our prenatal care. So some midwives will cover a lot of that, some not so much. It depends on who your care provider is. But Bradley is excellent. Then there's I don't think the word is generic, but I'm going to use the word generic, but a hybrid class that it takes from a lot of different theories and combines them. So it's breathing techniques which generally are slow, deep breathing. That is the one breathing technique we recommend. We no longer really recommend that patterned breathing like Lamaze. People want to call all the time and say, do you have a Lamaze class? And Lamaze is sort of old school. Your people my age, I did a Lamaze class with my first kid 23 years ago, right? So Lamaze was still popular then. Lamaze is that patterned breathing, that he who thing, that eyes open, patterned breathing, distraction is the theory behind Lamaze. And we know that actually Lamaze sort of falls apart when you go into active labor, because no animal in the animal kingdom actually births with their eyes open, looking at a partner, trying to be distracted, because you just really can't be distracted from active labor. So Lamaze, in my opinion, sort of falls apart in that once you start getting to be 3 minutes apart, lasting a minute, they've been that way for an hour, and things are getting serious. You don't want to open your eyes and be external. You intuitively want to go deep into your body. And we tell people that certainly folks that have a partner, one identifying marker of active labor is when the laboring person no longer can be in the frontal lobe of their brain. They're just, they go so deeply inward that there's no dialogue anymore. You can't answer simple questions because your brain is shifting to the primal cortex. And what happens in Lamaze is that it kind of forces you to be in the frontal lobe of your brain, where you're looking at someone and they're counting for you, and you're doing this complex patterned breathing, which is really kind of jarring when your brain really wants to shift into the primal cortex, where you intuitively want to shift and kind of close down. Like one of the moms that had her baby in this flurry of births we had, there were a few people in the room, which was wonderful because they were awesome support for her, but she was a first timer, and she intuitively was birthing in the tub or laboring in the tub, and she turned her back to the people in the room. Now, the people in the room were very supportive. They were very on board with an out-of-hospital birth. There was nobody was talking to her. The lights were low. All those perfect elements were there, but they were still in the room facing her. And so I didn't do anything. I don't want to say anything. She was doing great. She just intuitively turned around in the tub and was actually facing the corner. So she just wasn't making eye contact with anyone. She just actually had her head into the corner of the tub on her, intuitively on her hands and knees, doing her thing with her back to everybody. And she actually went very quickly. There was no talking, there was no coaching. She didn't need a lot of touching. She just really needed to just do her thing quietly, fairly undisturbed, which was beautiful. It's difficult for women to have an undisturbed birth, or folks to have an undisturbed birth, because for a variety of factors, it's just not culturally what we do, and it's hard to get to that place. But she did that intuitively on her own, and the people in the room that were supporting her were so respectful that nobody felt the need to go over and touch her and coach her through her contractions. She didn't need any coaching. She was doing fine. So whereas if she had done like a Lamaze class, she would have been focused on the outward part in the room, and there would have been a lot of chatter, and that actually would have disrupted her labor pattern. So we really like, and I hope that makes sense. Does that make sense?
Totally.
So we really like a hybrid childbirth class where the focus on the breath is just slow, deep breathing, and then they pull from a lot of different resources. So there's birthing from within, that is some super duper terrific work. Bradley is great. Lamaze probably has some aspects to it that are good, except for the pattern breathing and the eyes open. Then there's birth hypnosis, and there's two that I'm most familiar with, which is hypnobirthing and hypnobabies. Both of them are quite good. And then there is one from England. Oh gosh, I wish I would remember it. But one of my clients brought in a book from there, and it was a really, if anyone out there knows what I'm talking about, I would love it if you would comment below. But there's one particular birth hypnosis program out of England. And I looked at the book, and I've watched some of the videos on it. It's really quite good. And one of our clients did it, and I really liked it. And then there are, so you can do a go to a physical location.
Someone said gentle birth. Is it
gentle birth is, I think gentle birth is Barbara Harper's water birth book. I have the book in the other room in our library. I think gentle birth is from Barbara Harper, but I could be wrong. And it talks about the whole why water birth is so useful, because it is this gentle birth. Babies are born in the water, aquatherapy, and the benefits of water and relaxing in labor. I think that one is gentle birth, but it's not birth hypnosis, but I could be wrong. So we usually recommend, if you're having an out of hospital birth, we recommend that you find a childbirth education class that truly supports natural childbirth in an out of hospital setting, versus trying to go to a hospital to do a childbirth education course. Now, some hospitals might offer some really wonderful childbirth education, but in general, they're not geared towards really focusing on an unmedicated birth. There are some restrictions that some hospitals may impose on their childbirth educators, because there might be a conflict of interest in, they might want you to, in general, get an epidural. So some OBs don't always want you to have all of the information. Some do, so that's sort of a generalization. So we generally say, if you are birthing out of hospital, it's best to do a childbirth education class in an out of hospital setting. So a private educator. So locally, we have several locations. The Birth Co-op is one that teaches for us here at our birth center. It's a third party. They have their own location in here in the San Fernando Valley in Van Nuys. So going to one of those birth resource places, there's Beanie Birth in the Valley. There's a woman up here who teaches, her name is Callie, and she teaches a really great childbirth education class. Separately, she teaches in a different location. So finding someone that teaches in a location outside of a hospital, it's excellent for people that are choosing to birth in the hospital. We still recommend that you do a childbirth education class with a neutral person, someone not associated with a hospital, because you generally get a more comprehensive information. So there's that. But some hospitals will offer childbirth education. Their price point is usually quite good. And sometimes there are real gems that teach in a hospital. But in general, we say find a childbirth education class not at the location where you're choosing to deliver, unless it's at a birth center, because we're all invested in you having a natural childbirth, so those tend to be pretty neutral. But when we like to encourage you to take a childbirth education class if you're birthing in the hospital outside of the location where you're birthing. And they tend to be great. Then what's become very popular right now are online classes, because everybody has a busy schedule. It's hard to find the time with your partner to go to a childbirth class. So the Birth Co-op and Beanie, and I think Callie, and you could comment below if you're a childbirth educator and you teach, they generally do like weekend intensives. And that's really helpful. I know the Birth Co-op does for us, and they do at their other location. They'll do a Saturday, Sunday, a chunk of time. So it's available for a lot of people. And childbirth educators will also do private classes, or if you can on your own gather you and a couple of friends and find a location, you can find a childbirth educator that will do a class for you privately with a bunch of your friends, which is really super cool too. Then there are online courses. Mama Natural teaches a really good one that people are really, really liking. And then if you want a Christian perspective, there's a Heavenly Welcome. That's the one that we've referred to in the past, and people really, really like that course as well. So there are lots of options for online courses or in-person courses. You can do evenings during the week, once a week for 12 weeks, once a week for 6 weeks, once a week for 4 weeks, depending on the class. You can do a weekend class, which is helpful. So you always have lots of options out there. And we do think it's really helpful, especially for our first-time folks, to do a childbirth education class. And then you create community, like I said, and then perhaps you might meet a friend and you're due around the same time and you guys have babies at the same time. And then you come back together generally at like a 6-week postpartum, once everybody's had their babies, and you can come back and talk about your birth experiences and share your birth stories, and you've already started laying the foundation for relationship. And we talk a lot about why actual physical relationship is so important. Eyeball to eyeball physical touch relationship is critical for healthy relationships in general. And we see this rise in postpartum depression, and we've talked about this before. And a lot of it is because we're so isolated, and we're getting more and more isolated by all of our social platforms. So by getting into a physical location, it's really hard. We know it's hard to schedule the time, but to go someplace physically and have relationship and have a dialogue, we think is terrific. So if you have any great childbirth classes you've taken and you want to share them below, we would love that information. We can link below to Mama Natural, Beanie, the Birth Co-op, Callie, and a Heavenly Welcome. Those are the 5 those are just off the top of my head. We have some other wonderful childbirth educators, so if I did not mention you, please comment below, and we're happy to promote your classes. And there you have it. So if you have any questions, comments, comment below. This is a really important topic, and we think we love our childbirth educators. We think they're doing a great job out there, and the information is really valuable. So also birth hypnosis is really important. I know Alicia Tambori teaches a childbirth educator. That's a local thing. She teaches in a variety of locations. She's a hypnotherapist, and she's been teaching for a super long time, really well respected in the community. I'm not up on who our Hypno Baby instructors are currently. I know they've changed their curriculum a little bit, so I'm not sure who locally is doing those classes, but Hypno Babies and Hypno Birthing are 2 of the popular ones. And that just talks about hypnosis is a great tool for going deep. It's basically, hypnosis is deep relaxation. You might have a meditation practice, you might pray, all of those. When you're deeply dropping into that place, it's a state of deep relaxation. Birth hypnosis, you're still alert, like you're not in a trance, you know where you are, but you are able to take yourself into a deeply relaxed state. And it is a tool, right? It is not the only tool, but it is a tool that is so helpful in labor to get yourself to that deeply relaxed state. So birth hypnosis is terrific, or doing a couple of sessions with a hypnotherapist, or working with, if you're Christian focused, if you have your prayer warriors around you and you work and you daily practice your praying and going into that deep state of connection, or meditation. It is so helpful in labor. People that are Christian, we bring in scripture, they can play worship music. And it's amazing when you let go of the fear and you have a place to go that you can relax and let go of the voices in your head. And I'm trying to find the words for it, but it's just, you go into this deeply relaxed state. I did it with my second son, where I just, sort of sat in this chair and you get to a deeply relaxed state. And then if you let go of the tension in your body, it's fear, tension, pain syndrome, right? So if you get to a place where you can let go of the fear and you can relax all the muscles in your body, you go into this deeply relaxed state, and therefore you have less pain and your labor goes a little bit faster and you have a more positive experience. So there's that in a nutshell. So I encourage you to look at all the different modalities, ask questions about the different types of childbirth education classes, and we're happy to help direct you to find the right class for you. So I hope that's helpful. If you have any questions or concerns, of course, you can always contact us, SCV Birth Center. You can call us, email us, check us out on our different social platforms. And if you think this is helpful for friends, please share so everyone can just get the information they need so they can make informed decisions about their birth. Okay? Have a great day, you guys, and I'll see you next week.